So with that, I'm going to go ahead and get into some of the questions that we have received. Patrick Johnstone, KNOP, with a lot of schooling and work being done from home, have there been discussions or plans to expand internet access for rural areas that may not have access to strong internet? And actually, the Public Service Commission actually has a program for low-income families, so you can check that out on their website to be able to get that internet service subsidized. So if you're one of those families that is looking to be able to add internet access because of the pandemic and kids staying from home, please go check out the Public Service Commission's website. Matt Wiesner, NTV. Total COVID cases in long-term care facilities, nursing home facilities in Nebraska to date, and total deaths. So we've had 242 total cases and 48 deaths in long-term care facilities out of about 52 total nursing homes that have been impacted by that. And I know that many of those have been in hospice care. So we do release that number for the media if you have an interest. Again, we will do it based on an aggregate of all long-term care facilities, but we are not going to break that out by individual facilities. But total deaths in long-term care facilities, 48 for the state. And to put that in perspective, that's out of, as of 6 o'clock last night, it was about 70 total fatalities in our state. Tara Campbell, WOWT. Are there plans to extend the executive order halting eviction hearings for tenants impacted by COVID-19 past May 31st? We will certainly take a look at that with regard to where we are with regard to the emergency as we get closer to that date of May 31st. What protections for tenants will there be in place to prevent mass evictions once the order runs out? So again, the reminder for how we structured this executive order is that we waived the statute that requires this to be processed in 14 days. But every one of these evictions will still have to go through the court process, so there's not like a mass eviction. Every one of these cases will have to be adjudicated independently at the rate that the courts are going to do that. Are public health concerns about where tenants will go if they are evicted? Homeless shelters are already full. So again, I want to remind people that the evictions that we have waived that requirement on are the ones that are impacted specifically about coronavirus, and that to that we are working, as we mentioned yesterday in our press briefing, very diligently on getting those payments out with regard to the unemployment benefits, the pandemic unemployment insurance coverage that is we're working to get through as well. That just started processing earlier this week, so that is going out the door, plus the $600 from the federal government as part of the overall emergency response. So people should start getting those. So my point of getting into all that is that we expect that a lot of people will be able to have the funds available to be able to make their rent. So certainly we want to make sure that tenants have that possibility. And just as a reminder, the executive order does not cover people who are engaged in criminal activity or who have been vandalizing the apartments or anything like that. So just keep that in mind, that it's not everybody, because there are legitimate public health concerns about people who are doing criminal activity in apartment buildings or damaging the facilities. Elise Balin from the Scottsbluff Star-Herald. Could the state of Nebraska do like Wyoming's Food Freedom Act and lift restrictions on beef and pork from meeting FDA inspections to allow meat to be directly sold to consumers? We kind of talked to this about the other day, and Steve, I'm sorry, I was going to ask you about this beforehand, so I surprised John yesterday, so I'll surprise you. So how can Wyoming waive the USDA's requirement for inspections? Do you know what that food freedom?
They have their own state inspections, and they have some different legislation for Food Act.
So Wyoming has different legislation, and they have their own inspectors with regard to that. So they had the ability to waive those inspections, whereas we use the USDA inspectors, and that would require USDA waiving of those inspections. Is that accurate?
I'm not sure they're waiving the inspections though either.
You don't think they're waiving the inspections either, though? Okay.
They have law in place that allows them to utilize their state inspectors.
So they have laws that allow a law in place that allow them to use their state inspectors to be able to accomplish the inspections so that meat can be sold.
Correct.
To it. We don't have that law in the books, so we cannot do that here in the state of Nebraska. Did I get that right?
Yes.
Okay, Elise, you got your answer right there. Steve says yes. So again, Wyoming's got different laws. We don't have those laws in place to be able to use our state inspectors, but those meat lockers are still being inspected in Wyoming just by state inspectors. They have to be done by USDA. And just so you know, folks, we have looked into this as well. I think we covered this in the last couple of days. Even if we could get that waiver of inspection, my understanding is that most of these meat lockers are operating at overcapacity right now anyway. So I'm not sure that it actually would benefit much because they're already working as hard as they can with the current business they have. I don't think we'll be able to get any additional processing out of them. What is the state of Nebraska doing to help producers get through struggles of meatpacking plant closures and issues with meatpacking plants employees not returning to work? And again, one of the things we're doing here at the state of Nebraska is we've reached out to USDA, Secretary Sonny Perdue, to be able to talk to him about this. One of the things that they have done is they've started a program, a $19 billion program. $16 billion of that will be paid out to producers across the country. And then $3 billion of it will be used to purchase things like dairy, fresh produce, and things like that for food banks. So USDA has an overall $19 billion to help out producers in our country. Admittedly, though, $19 billion, while it's a lot of money, gets spread out over the entire country, that it's just going to be a step. Another thing that we have been working with and encouraging the USDA to do, and I know Sonny Perdue has got an investigation going on specifically with regard to pricing. Box beef is fetching a much higher price than what our producers are getting for their cattle, so that's one of the issues that USDA, and that's been an ongoing issue, by the way, that's not just a pandemic issue. And so that's one of the things USDA is investigating with regard to how to get some relief to our producers. And the question was, even if a temporary change in a state policy could help meat producers get through this time of hardship, why is not a step being taken? So I think, again, we're looking at a variety of things to be able to do to help that. Steve, is there anything you want to come up here and say with regard to that question?
Yeah, we've looked into this quite a bit over the last month on what we can do and how we can be helpful in Nebraska to actually get products from the farm through the custom exempt lockers and our local lockers and processors. Again, as was mentioned, it is a USDA inspection rule. Nebraska statutes, we do not have state inspections, so we rely on USDA. So it would take a change of the law. And currently, we've reached out to across the state and to these local processing facilities, and they are maxed out. They're busy. Good for them at this point that they have this business, but I think they're pretty much tapped out on what they can actually accomplish. But we continue to look at that and see what else we can do to help get animals from market-ready animals from the farms into the consumer's hands. So we'll continue to work on that.
Great, thank you, Steve. Okay, yeah.
The shortest, the quickest I've heard that you can.
Do you want to come up here? Why don't you come up here, Buck?
You can just repeat that.
Okay.
The quickest you can get in is like 5 months.
So Buck is saying the quickest you can get into one of these meat lockers is going to be 5 months. So again, not something that's probably going to be able to be of benefit in the short term for our producers. Thank you, Buck. All right, with that, we can go ahead and open up to questions and answers for the folks that are in the room.
Governor, the Sioux City Journal, citing an anonymous source that they say is familiar with the situation, says that 669 Tyson plant workers in Dakota City have tested positive. Do you have any information that would support or refute that? So
what Fred's saying is an anonymous source has said there are 669 people at the Tyson plant in Dakota City that have tested positive. We, the state, don't break out those numbers, and I haven't seen any numbers along those lines with regard to that. So I can't tell you how accurate that is or not. Other questions?
Here's some questions that have been submitted.
Oh, yeah, go ahead.
Andrew Zaki says the Nebraska Cattlemen called for the U.S. Department of Justice to investigate the price difference producers are being paid for cattle and the price meat packers are charging wholesalers and grocery stores. How much has this issue been placed on the back burner, and does it need to be addressed?
And so Andrew Saki is just following up that U.S. cattle producers have called the Department of Justice to be able to do an investigation. And how much of this has been placed on the back burner? In fact, I don't think it's been placed on the back burner at all. I think it's just the opposite. I think with the pandemic, this issue has only gotten more attention. And Steve, Buck, what do you think?
There's an ongoing investigation after the plant fire in Holcomb, Kansas, and now this has been added into the...
Yeah, so this...
I think the Department of Justice actually has been called in.
Yeah, so there was a plant fire down in Holcomb, Kansas that really kind of kicked off this investigation. and Buck believes the Department of Justice has been called in as part of the investigation.
Bill Shammer from 1011 wants to know if the state will share the unupdated total number of people statewide in hospitals, in ICU beds, and on ventilators.
So will the state share statewide data with regard to the number of people who are in hospitals, on ventilators, and in ICU beds? Is that the question? Yes, absolutely, we can do that. That can be, we already put out there the percent on those hospital beds being used and so forth, but we can make that available as part of our, we can either do it one-off bill, or we can put it as part of our playbook or something like that. So yeah, absolutely, we can show that aggregate data.
Aaron Duffy from the World Herald says that you said the meatpacking outbreaks may be attributable to community issues or workers shopping and catching the virus at the grocery store. Doesn't the fact that UNMC has had to develop a coronavirus playbook for plant operations suggest that plants or the close quarters work inside from them are fueling infections more so than community issues?
So the question was, I said that this is a community issue with regard to the infections and the spread of the virus in our communities with food processors. Doesn't the fact that UNMC is actually working with the food processors say that this is a food processor issue? And actually, again, it gets back to this is a community issue, so it's not just a food processor issue. We can have direct impact on working with the food processors to be able to take those good social distancing guidelines and the work that Shelley's doing around best practices and so forth. And then we also need to work on the community side too. So again, getting to folks, helping them with the social distancing, especially in communities where English is not the first language, so that we get that message out there with regard to social distancing, that we get cooperation when we're doing testing and tracing of contacts and that sort of thing. So it is a unified picture here, just focusing on one aspect of it, whether you're just focusing on the work aspect or the home aspect, either one individually is not going to be sufficient. If I led Aaron to think a different way, I apologize for the confusion on that. What I'm trying to get at is you have to look at this in its whole and not just focus on one or the other.
She also asked how many counties will have extended DHMs and until when. Are the details of those DHMs still being worked out with the local health departments, or is it just an extension of the restrictions already in place?
So again, we just kind of covered this with regard, Aaron's asking about the DHMs and the which counties are doing what. So Aaron, if you can look at your TV here, we got it right here. So 56 counties are going to be May 4th. These ones in light blue are going to be the ones that are going to be in, they're going to be coming up here May 11th. And then the green counties, again, this is the ones we're still working with regard to that DHM. So again, these are the counties that are being more heavily impacted. So you can expect that those are probably going to get pushed off to a later date, but we're still working with the public health department officials on that.
Andrew Ozaki has a few questions about state facilities. What do we know about possible residents for the veteran home in Kearney who tested positive for COVID?
So actually, I just got briefed on this today. The question from Andrew Ozaki was, what do we know about residents at the Central Nebraska Veterans Home who've tested positive? My understanding is that we had 4 people test positive. They've all recovered, and that we actually had, had special designations where we were, concerned about where people were testing positive, but all those restrictions have been lifted. So that's a ballpark answer. So maybe what we can do, Taylor, is just follow up John Hildred directly and have him talk to Andrew or give him a statement or something like that. But my understanding is, based upon our conversation today, that all those residents have recovered.
Are there any updates on cases in other 24-hour facilities that you're aware of?
Are there updates on cases in other 24-hour facilities that I'm aware of? I don't have any updates, but Shelley, I will ask you if you have any updates of 24-hour facilities that you know of. So,
No, I mean, just other than healthcare and long-term care.
yeah, just long-term care, we continue to manage it. Dr. Anto?
I have the hospital data for hospitals, the high-volume hospitals, like in Grand Island.
I think he's looking more at the 24-hour facilities, though, where we're caring people, like, things like the Lincoln Regional Center and things like that. Or,
Nothing new.
okay, nothing new. Nope, nothing new there.
And he also wants to know, with the state hasn't tested any inmates for COVID, are we going to allocate tests for them?
So again, with regard, Andrew's asking about inmates, and so again, the inmates will be treated like everybody else. We have a law in Nebraska; they've got to receive that community standard of care. So again, it would be the same procedure, whether you're an inmate or if you're in another facility. If somebody gets tested positive, we do the contact tracing, we reach out, all that sort of thing. So that's again how our inmates are going to be treated.
And then we have a question from Alexander Stone. from a viewer. As people are asked to go back to their offices, what guidelines should they follow? Should they wear a mask or keep desks 6 to 8 feet apart? Do we have other recommendations for them?
So Alexander Stone is asking if people are starting to go back into the workplace, what sort of guidelines should they follow? Should they wear a mask? They should keep 6 foot of distance? The answer is yes. So all those things are really good ideas. So when we're talking about our rules, which we don't have up here right now, but when we talk about our rules, those are all still good things to practice. When you're carpooling, don't carpool with anybody outside your household. Generally, that'd be a better idea. If you are carpooling with other people, only one other person, one person in the front with a mask, one person in the back with a mask. That would be a best practice when it comes to carpooling. Don't share your lunch, bring your own lunch, don't share utensils. Wipe down surfaces frequently, especially high-touch ones. Wearing the mask, 6 foot distance, avoid groups of more than 10 people. These are all the sorts of things that as you are in the workplace that will allow you to have those rules around social distancing. Is that it?
That's all I got.
Okay, yeah. No, go ahead.
Quite a few protesters out front today. Obviously, they're happy the state is reopening, but maybe want a more aggressive approach. Any comment for them?
So the question was, we actually had protesters here at the Capitol today. Thankful that we're starting to open up the state, but want a more aggressive approach with regard to opening the state. And again, what we're going to do is we're going to take this a step at a time. Again, we'll take a step back here as well. The whole goal is to make sure we don't overwhelm the healthcare system. That's what our goal was 2 months ago when we set out on this, was to make sure that everybody who needs that hospital bed, ICU bed, or ventilator can get access to it here in Nebraska. And that's why we put these restrictions in place. And they've been successful. They've worked. Nebraskans have been extremely patient. They've worked with us. They've sacrificed. And we've been successful everywhere. Even in our hot zones, places like Hall County, we've been able to manage it in a way that everybody's received that care. And now, as we start loosening restrictions, we're going to continue to keep an eye on the healthcare system. So we're going to take this a step at a time, start loosening restrictions gradually, make sure we can keep the healthcare system stable, right? Preserve that healthcare system so that everybody can get that care, and then we will start loosening these restrictions as we see that we're able to do that. So we're going to, again, take a methodical approach about it. I know everybody's tired of doing this, but we got to do this in a way to make sure that we can still preserve our healthcare system. Yeah.
I have a question for Shelley, if she would.
Shelley, you are up. I told you you might get questions.
I was just wondering sort of.
No, come on up here. They got to be able to hear you. And so when repeat the question so that they can hear it at the microphone.
I just want to know sort of what the implementation process will look like, or if you're aiming to get every facility in the state to sort of have this, or what the approach looks like when you're talking to these facilities.
Yeah, so far we've been able to.
Repeat the question.
Oh, the question was, what is our approach with all of these meatpacking plant facilities, and how will we go about that? So for right now, it's working well that they reach out to us and request a visit. So a lot of times that comes from our public health partners. So then they make contact with the plant, or we've even started to get some questions from processing locations that aren't necessarily doing the whole cycle. So we've shared our tool broadly, and they do a self-assessment. I actually got a self-assessment back from a plant today. And then we do a phone call. So it's just really up to them what process works well. So does that help?
But it is a goal to try and get everybody using these best practices.
Yes, absolutely.
And then the second part is, as we continue sort of on in this, is there, I know you published this one here, is there any chance that you would add to it or make adjustments as need be?
Yes. So the question was, is there going to be any additional guidance that we provide or any updates? Only daily is what I will say. So you will always find the most up-to-date copy out on the Global Center for Health Security website. Okay.
Great, thank you, Shelley. And Shelley has been putting on a lot of miles on the car getting around to these facilities. So thank you very much, Shelley, for all your hard work and the hard work of your team to be able to make these visits.
Governor, is it within your power to make these best practices mandatory, or is it entirely up to the companies?
So the question was, is it within my power to make these mandatory? Again, the approach we're taking is these are non-regulatory. So this is about cooperation. And really, this is the same approach we've taken with regard to this entire health emergency. Really taking an approach of communicating, getting people's collaboration to be able to get that effort that we need to have this to be able to work. With regard to inspections and things like that, that's actually OSHA. So the actual regulatory side of this is actually a federal government responsibility. Go ahead, Fred.
Okay. I have heard, and I haven't confirmed this, that residents that are positive for COVID-19 in Hall County are being kept in their long-term care facilities and not transferred to the hospital. Is that true, and is that desirable?
So Fred has said that he's heard that in Hall County that residents in long-term care facilities are not being transferred to the hospital, they're being kept in their facility. Let me take a step back. Our policy with regard to long-term care facilities is that if somebody tests COVID positive, coronavirus positive, as a resident, that they are isolated within the facility if that's possible. And if they need acute care, then they go to the hospital. And so once they no longer need acute care, then we transfer them back out of the hospital and preferably back to the residence where they came from, if it's possible, if it can be done safely. Now, if that can't be done safely, we find other accommodations for them. So, for example, take the Blair House or the Carter House in Blair. In that case, it was actually had to do with the workers. Enough workers had tested positive that we were worried about being able to provide that 24-hour care. So then all the residents were moved out to other facilities that we had previously arranged to make sure they could be cared for until the facility would be clean. The workers, we could reestablish the workforce and that sort of thing, and then the residents were moved back. So it really is a case-by-case basis with regard to the facility and what they're actually able to handle, and it's a variety of things with regard to their layout, how they can isolate people, workforce, the status of the workforce, that sort of thing.
So it's not the case that people are being kept in.
So Hall County is not an exception that we're asking people to isolate within their facility if it's possible. Other questions? Friday afternoon, everybody wants to go home? I'm cool with that, just so you know.
We have a question.
Oh, Taylor.
Kristen Whitman at KPTM. Can COVID be carried in beef or poultry?
So the question from Crispin Whitman at KPTM asked, can coronavirus be carried in beef or poultry? And the answer is no, it's a respiratory virus. It gets spread. This is why masks work really well, right? Because they're spread through the droplets that you may exhale or cough out. And so that's why we ask people to wear masks. But it's not bloodborne transmission, it can't be borne by mosquitoes, it's not transferred through beef or poultry or anything like that. Yeah, Brandon.
CNN was in Dakota City doing a story about the situation there, and obviously you've talked about all the stuff that's been done safety measures wise, but could you speak or comment on just the fact that that area is getting national attention?
The Dakota asked to comment on the fact that Dakota City is getting national attention. I don't really have any comment to make that Dakota City is getting national attention. Again, we're working very hard there with the facility we supplied logistical support from the National Guard to help them do a lot of testing up there over the last couple of days, and all the other things that Shelley's talked about with regard to our meat processors handbook, all the things we're doing to reach out to the community with regard to non-English speakers and all that sort of thing. So we're working the plan there just like we're working it in Hall County, Dawson County, and any place else that we need to.
Governor, do you want to mention that these facilities were well into precautions and protocols before we started the visiting them?
And Director Wellman just wants me to remind people that the facilities started taking steps even before we started reaching out to them and talking about what kind of precautions they ought to be taking. So, again, we try to make this a collaborative approach to be able to get best practices established and get all the facilities to be able to adopt those. Okay, I'm not seeing any other questions, so I'm going to go ahead and roll it up here. Friday afternoon. Happy May Day, everybody. Again, I want to thank all the Nebraskans who have worked so hard to be able to slow the spread of coronavirus here in our state. Please continue to follow our rules with regard to social distancing. That 6-foot distance rule, respect the 10-person rule. And especially as you think about Cinco de Mayo parties next week or Memorial Day parties later on in the month, we want you to best practice, celebrate only with your household, but in any case, no more than 10 people. Please continue to follow those good guidelines, and that will help make sure that we slow the spread here in the state and preserve our healthcare system for those vulnerable folks who will need it. Thank you all very much. Have a great afternoon and a great weekend.